is Pam Eliason. I'm the training manager at the Massachusetts Toxics Use Reduction Institute. Our work at TURI focuses on helping make Massachusetts a safer place to live and work. We do this in a number of ways, and you can learn more about that by visiting our website, www.turi.org. In the past 15 or so months, a primary focus at TURI has been to disseminate information on safer disinfectants and to provide guidance on the importance of using safer cleaning and disinfecting products and practices in households, offices, institutions, and industrial settings. We've had the good fortune to work with the speakers in today's webinar to help guide purchasing recommendations for safer cleaners and disinfectants, and to develop detailed information on the challenges and solutions associated with maintaining as clean and safe an indoor environment as possible. Today's webinar will focus on the purchase and use challenges and solutions particular to disinfecting products, equipment, and services. Our speakers include Julia Wolfe, the Director of Environmental Purchasing at the Massachusetts Operational Services Division. We have Carol Westinghouse, President of Informed Green Solutions, and Lynn Rose, an environmental health and safety consultant who specializes in the intricacies of product choices and uses in schools and institutions. I'll let each speaker tell you more about themselves. Before we begin, however, I'd like to invite you all to tell us a bit about yourselves. So please use the chat function to share your name, your affiliation, and a nugget about your cleaning and disinfecting challenges or what you're hoping to learn this morning. We have a lot of material to go over, so we're going to hold off on questions until the end. But I do encourage you to go ahead and post questions in the chat as they occur to you. We'll get to as many questions as we have time for at the end. This webinar is being recorded. All participants are on mute for the duration of the webinar. If I notice that somebody is off mute, I might mute you. So just, apologies for that up front. The slides and recording are going to be available on TURI's website. So you can just go to www.turi.org and click on our training page. And then what you do is you look for the continuing education and then recent training presentations, or you can simply search for today's date and the word webinar on our search function. So now I'd like to invite Julia Wolfe to share your screen and to tell us more about OSD's services and interests in this topic. Julia.
Great, thanks. Can you guys see my screen?
We see your presentation mode, your presenter mode, instead of the actual slides.
Oh, okay.
So what you might want to do is stop sharing and then share your different view. So that it's just the slides.
Yeah, I find if I'm using both.
How's that?
It's okay. There, she's got it. Okay.
I've got it. Great. Thank you so much. Good morning, everybody. My name is Julia Wolfe. I'm the Director of Environmental Purchasing for the Commonwealth of Massachusetts Operational Services Division, or OSD as we call it. And I've been working with OSD for 8 years now. I think it's going on 9. And previously worked with the Massachusetts Department of Environmental Protection, working on toxics and solid waste policy and programs. And previous to that, I worked with the U.S. Environmental Protection Agency. So I'm thrilled to be here today, collaborating with Carol and Lynn to bring you this focused webinar on safer cleaning and disinfecting, targeted at purchase and use. And I'm really excited just to see the many participants on this webinar today. So I want to thank TURI for helping fund this webinar and Pam for moderating. It's really a pleasure to work with all of these folks who are experts in this area. So it's been quite a year navigating cleaning and disinfecting processes and products with the pandemic. And I am so pleased that it looks like we're heading to a better place. With that said, there's still many issues with safer cleaning and disinfecting that we believe is really important to go over. not only from a buyer and facility manager point of view, but also for the vendor community. So I'm going to talk just for a few minutes about OSD and some of the environmentally preferable cleaning products and services we have on our contracts. Okay. So OSD is the state agency that establishes and manages about 110 statewide contracts for goods and services. We also manage a few other programs listed over here on the left. We have 16 categories of products and services with over 1.9 billion in annual spend. And this really represents a good buying power. So public agencies, municipalities, public colleges and universities, some nonprofits, and other other states actually can use our contracts. We have a robust environmentally preferable products procurement program for about 25 years now. And we also have an executive order that was signed in 2009 with OSD as the oversight agency, and it directs departments to establish an environmental purchasing program. So basically, I work with our sourcing teams to help integrate environmentally preferable specifications into the statewide contracts. And we also publish an annual progress report on Executive Order 515. And we have lots of resources available for finding EPPs in our contracts and on our contracts. Like the EPP products and services guide, which is on here. So I also help co-chair the Toxic Reduction Task Force, which provides guidance to OSD on reduced toxics in products. And in 2009, the task force targeted safer cleaning and disinfecting products. So we developed specifications for, and we bid out an all green cleaning products contract, which I'll review in a minute, called FAC 85. And we have a number of contracts that have cleaning and disinfecting products, and they're all listed here. Most of them must abide by the green specifications, whether the contract provides cleaning products or provides a cleaning service. And for service contracts, we really recommend that you have a scope of work that identifies safer cleaning and disinfecting products and practices. So this webinar really is going to provide you with a number of tools and information on considerations to put in your scope of work. One of our flagship green contracts here at OSD is FAC 85 for environmentally preferable cleaning products, programs, equipment, and supplies. It's a multi-state contract. We have over 14,000 environmentally preferable products on this contract, and most of the products must meet third-party environmental certifications or recycled content requirements. And we also identified specifications for safer sanitizers and disinfectants with allowable and prohibited active ingredients. So this is meant to be a one-stop shop contract for buyers to easily find green cleaning products. We're in the process of rebidding this contract to FAC 118, which will be live by March 2022. So if you are a vendor who's interested in bidding, make sure that you are registered in our online procurement system, Combis, in order to receive notification of the bid. So now, during the state of emergency in Massachusetts, and we're currently still in the state of emergency, we had to relax the requirements for disinfectants due to supply chain issues. This meant that we allowed all EPA registered disinfectants that were on the EPA list N. And I think Carol and Lynn will go over that, if you don't know what the EPA list N is. And I just saw that the governor announced we will be lifting the state of emergency on June 15th, which is great. And this will mean that we'll go back to our original specifications, only allowing disinfectants with safer active ingredients on this contract. So over the past year, we've continued to recommend that buyers choose safer disinfectants if they were available. And Lynn and Carol, they're going to go over this presentation. So we hope that this webinar provides facility managers with really some good information as facility managers, we recommend that you ask a lot of questions of your vendors. And we hope this webinar will provide helpful information to the vendor community as well on navigating environmental and health issues with cleaning and disinfecting products and equipment. So that is it for me. Here is my contact information and links to OSD resources should you, have any questions. Thank you.
Thank you, Julia. So while Julia stops sharing and Lynn and Carol start to share their presentation, I've just launched a poll. I thank you all for putting in information in the chat, and not everyone has been able to. So go ahead and let us know which role most closely resembles the function that you serve at your work. This is going to really be helpful for our speakers so that they can make sure that they're kind of, addressing your specific needs. And I'll just give it a couple more minutes, pardon me. I'm not going to give it a couple more minutes. We'll give it less than a minute, try to get everybody in there. We've got about 2/3 of you have answered the poll. If you haven't, go ahead and just, what is most closely resembles what you do. If none of those options fit you, just hit other. That's fine too. Couple more seconds. Okay. All right. Well, why don't I'm gonna stop the poll and I'll share the results with you. So the majority of people who are joining us today are facility managers, but we have a large percentage of cleaning supplies vendors. So I'm sure that is either product or equipment. We have some service providers here and environmental health and safety managers. So great. Thank you all so much. I'm going to stop sharing results and I'm going to hand this over now to Carol. Carol, why don't you introduce yourself to our audience and take it away.
Thanks, Pam. And thanks so much, Julia, for that overview. Very good information for all of us. Good morning. I'm Carol Westinghouse, president of Informed Green Solutions, an environmental health nonprofit. I've been working with schools and childcare programs for nearly 20 years on indoor air quality and environmental health, specializing in cleaning, sanitizing, and disinfecting. I'm the co-author of the Infection Control Handbook for Schools with Lynn and of the Green Cleaning, Sanitizing, and Disinfecting Toolkit for Early Care and Education. Next.
Oh.
Navigating the shifting sands of the changing landscape has been the theme of the past year, as you all know. And the goals of this presentation are to review infection control strategies, environmental health risks to workers and building occupants from the use of cleaning and disinfectant products, the criteria, tools, and resources to provide to purchasers on identifying and selecting safer products, equipment, and services, concerns and precautions regarding the use of disinfectant application equipment, and navigating shifting federal guidance. Next. And this is the model that public health professionals are recommending. It takes all of these actions to reduce the transmission of the SARS-CoV-2 virus. We can't just disinfect our way out of the pandemic, and new guidance is asking us to reduce the amount of disinfecting we are doing. Next. This is a graphic of how the virus is transmitted. When we talk, sing, breathe, cough, or sneeze, we create droplets. Some are larger and some smaller. They then become airborne and are inhaled by others, drop on surfaces, linger in the air, or are removed from the air by ventilation or filtration. Droplets on surfaces are not the main transmission route, according to the CDC and scientists around the world. The risk of getting COVID-19 from surfaces is 1 in 10,000, according to the CDC. And by comparison, the risk of getting hit by lightning is 1 in 3,000. Next. Cleaning, sanitizing, and disinfecting are the procedures we use to help break the chain of infection, whether for conventional flu or SARS-CoV-2. To review, cleaning with a disinfectant and a microfiber cloth is a recommended way to remove microbes or germs and the conditions they need to survive. Some research has found that the outer fat or lipid coating of the SARS-CoV-2 and other viruses can be inactivated by detergent, soap, water, and friction, like washing our hands. However, we don't have enough research right now to definitively say this. Researchers are investigating it though. And even if that isn't the case, cleaning first is essential in that it removes dirt, grime, detergent residue, etc., that can interfere with the activity of a sanitizer or disinfectant. If you are using an electrostatic or any other kind of sprayer, the surfaces should still be cleaned first before disinfecting. Next. Sanitizing inactivates a large percentage of microbes deemed sufficient to control disease spread and protect public health. Sanitizers are used on food contact surfaces and some soft surfaces. They are very important for childcare programs and food preparation and eating areas. In childcare, most surfaces are considered food contact, such as mouth toys, tables, and other surfaces that many hands and mouths may touch. In schools, children now eat in classrooms, gyms, libraries, and other places, so these need to be treated as food contact areas. The EPA's List N lists some products that are both disinfectants and sanitizers at different dilutions. Users should be advised that these dual products may not need rinsing as a sanitizer, but do need rinsing as a disinfectant. Next. Disinfectants are used on non-porous surfaces that have previously been cleaned. Clean first, then disinfect is the best practice. Disinfectants are important in schools and childcare for use on higher risk surfaces such as diaper changing tables, high touch areas, bathrooms, etc. Next slide. So why do we want to use safer products in schools and childcare programs? Well, because children are not just little adults. They're exposed to the same dose of environmental toxins and cleaning products. And when they have proportionately a much greater exposure when compared to adults. So breathing in bleach fumes, for example, is more harmful to a child than an adult. They breathe more air for their size than adults do. They live in a different breathing zone in the world, closer to the ground where chemical droplets may collect. And children are at greater risk than adults when exposed to toxins because they are exposed at higher levels. They eat more food, breathe more air, drink more water, play closer to the ground, hand and mouth activity. They metabolize and eliminate toxins more slowly than adults, and their immature immune systems are more vulnerable. Next slide. In our updated infection control handbook for schools, soon available on the TURI website, we developed this table to illustrate products to avoid, use with caution, and that are safer. Now that the original EPP contracts will be back in place, they will only list the safer disinfectant choices. But it's important for purchasers and vendors to be aware of this information and where your products fall on this spectrum. Bleach and quaternary ammonium compounds are to be avoided, especially for use in schools and childcare programs for many reasons. The combination of hydrogen peroxide and peroxyacetic acid, as you can see here in the use with caution zone, has some issues. Well, at the same time, the hydrogen peroxide without the peroxyacetic acid is a preferred product. Next slide. Why do we advise against using bleach and quaternary compounds? Research has shown that bleach and quats cause new onset asthma in custodial workers and professional cleaners. One journal article reports, epidemiological studies have shown an association between cleaning work and asthma. The main sensitizers contained in cleaning products are disinfectants, quaternary ammonium compounds such as benzalkonium chloride, amine compounds, and fragrances. This is just one study. I have pages of studies linking ingredients in cleaning products with health issues. I actually stopped compiling them in 2018 because I couldn't keep up with all the new information coming out. Next slide. Quats, some of our most common active ingredients in disinfectants, are also linked to endocrine or hormone disruption. We're seeing girls as young as 6 begin menstruating and an increase in cancers related to hormone disruption. Some quats leave a film on surfaces that must be rinsed so that children do not absorb it through their skin. This is why we have included quats and bleach as ingredients to avoid. These not only affect the students in schools, but the custodial and other staff also. Next slide. The American Academy of Pediatrics advises against using quats and bleach around children and using products with active ingredients approved by the Design for the Environment Disinfectants program. Next slide. Our next section covers the information it's important to provide purchasers and vendors on selection and use. This information is a result of our work with schools over the years, and especially during the last year. We want to share what end users are telling us they really need to know. Next. So how do we identify safer cleaning products? We rely on third-party certifiers and agencies such as the OSD EPP program. Third-party certifiers include Green Seal, a nonprofit, UL Eco Logo, part of the Underwriter Laboratories, and Safer Choice and EPA program. These organizations develop standards and approve those products that meet or exceed those standards. Products must also meet requirements for performance, ingredient disclosure, and volatile organic compounds. The Design for the Environment Disinfectants program is the only entity that can really certify safer disinfectants. Next slide. EPA's sister program, Design for the Environment's Disinfectants program, assesses ingredient alternatives and lists them on their website and allows qualifying products that have met their standards to carry the DFE logo as safer products. These are the safer active ingredients, and they're similar to the ones that the American Academy of Pediatrics listed. Next slide. Some additional resources for selecting safer disinfectants can be found on these websites. Thank you very much, and I'll turn it over to Lynn Rose now.
Good morning, everybody. Welcome. I just wanted to say my big screen's here and you're over here, so I'm going to go back and forth. And I'm really excited to bring this information together with you because it was really born out of the work that we did over the last year to kind of navigate the new products coming on the scene, the navigating the fear factor and helping people separate, what was, what made sense to do, what was safe to do versus what people felt they could possibly do. There were supply chain issues. There was lots of new products. And so this was really born out of the need to navigate that information. And so these are really lessons learned. And the target audience of this is a combined audience of people that actually buying the products with the people who are selling them, because I had lots of experience on both ends of it, because I actually do purchasing for school districts and I worked really extensively with vendors, and I went out to bid and I sorted products, and I worked really closely with Julia at OSD to evaluate products. And not everybody has a Lynn Rose to help them navigate this. And what people were saying is, I really rely on my vendors. Well, my experience was it's a range of information that you get from vendors. And if a vendor is dealing with a really new product they're not familiar with, there can be real issues with what information gets communicated and how accurate that information is, and how well the vendor is helping the customer sort out what makes sense for their situation. So this is really guidance for vendors, but also for buyers. And it was really born out of a lot of challenges this year. So, I would start by saying, we're going to go back now. CDC just announced, I have throughout my presentation this news alert, because what's happening when Carol said the changing sands is that all through the year, CDC, EPA, there was new guidelines, there was new standards. People reverted back to using products like at OSD allowed because of the supply chain issues. So throughout my presentation, I will highlight some of those changes, some of the things that came on the scene and are now being retracted, because again, there's a lot going on. And so one of the key things that we really want people to focus on is that we no longer have to go after surfaces the way that we did. And that when we're calculating how much chemicals to buy for disinfection, we want to go back to pre-pandemic. We are talking about, we can just clean. CDC said you can really just clean touch points. And the only time that you're really needing to disinfect is if somebody has been sick in that space, or if there's an outbreak. If there is a reason to disinfect, and some of those reasons are the high risk areas, right? The nurse's office, we have what's called medical waiting rooms in Massachusetts schools where they send kids to wait until they get sent home if they're suspected to have COVID. So that is a really high risk area. The other thing that's going on is we have an area where we're doing what's called aerosolizing procedures that normally would only happen in a hospital. Those are really high risk procedures. So, or high risk areas that need to be cleaned and disinfected. So it's really important to understand what is going on in that space, who is using that space, are they a vulnerable population that Carol was talking about? And then there's what we call regulated circumstances with bloodborne, toileting, food contact, and those are a given. What we don't want to see is, we saw a lot of this. We saw floors and walls being disinfected, and unless it's skin contact, there's absolutely no reason to do that. And so one of the things that came up was we had contractors that were coming in some of these schools where there was an outbreak and people were nervous, and they brought in special, decontaminating services. And what we saw was what they called pre-disinfection. And that was where they went in and sprayed the space. They went in with respirators and suits, and they went in and pre-sprayed before they went in and cleaned and disinfected. And we were trying to figure out what is the origins of this guidance or this activity. And so we found it on ISSA. It was one of their protocols under decontamination. And one of the things that we want to discuss, why is this not an appropriate strategy, right? So they're saying you need to pre-disinfect, then clean and post-disinfect. Well, there's no such thing as pre-disinfect if disinfecting requires cleaning and then disinfecting. And so they're saying is, oh, well, there's a situation with a potentially high bioload. And we don't recommend this because what we were seeing is they were going in and spraying the air and spraying the walls and the floors, and some people actually putting disinfectant in auto scrubbers and then spraying after. I mean, the amount of chemicals that were being put into spaces was really frightening. And that goes back to something Carol said, which is, if they're quaternary compounds, then they're going to leave a film, and that can be an issue. So there was no need. We are struggling with custodians not to go broadcast spray into the air We don't want to see vendors doing that. And not only does it put chemicals into the space more than is absolutely necessary, but it also they were charging the schools for this. And there was a lot of fear factors, and people really didn't know what needed to be done early on. So this is one of the things that we generated as part of our handbook. And I'm not going to go into it other than to say this is available in our handbook. And what it was designed to do was you can give this out to every different department or classroom to say, these are the high touch points. These are the things that you need to focus on in your cleaning for infection control. So we worked really hard at trying to provide tools and guidance that were practical and accessible. So another thing to think about is that a lot of the products being used now, like for instance, the hypochlorous tabs, they only last 3 to 7 days in solution. So one of the things that we were really having to look at in terms of developing procedures, because I also develop procedures and do training, was how do we manage the solution? How do we date it? How do we make sure that people are using a solution that's viable? And how do we keep people from making up more than what they need? And if people are familiar, bleach only lasts 24 hours. So we made these stickers to help people navigate, and keep track of that information. But the real issue here is the expiration dates and stability of the products being used. A lot of people don't really understand this. And here's a situation which I can personally attest to, just spent thousands of dollars getting rid of disinfectants that we had over purchased. I mean, school districts got a lot of money and they used it up, and there was supply chain issues. So people were buying as much as they could. People really concerned about being prepared for students coming back. And I can now tell you at the end of the year, a lot of this is expired and it is going out as hazardous waste, because most disinfectants and sanitizers, antimicrobials in concentrate are considered hazardous waste. So they have to be stored that way. And there are also a lot of them are flammable, they're oxidizers. So this is something when you purchase, you want to look at expiration dates. So now we're ordering, now come for the summer where they've now learned to say, so Lynn, what's the expiration date? How much should I order? So, I mean, this is an issue for storage and for disposal. And it's also an issue for efficacy. Here's a situation where when you buy bloodborne kits, the real issue I find as a trainer who does bloodborne pathogens and oversees these programs is that the things that expire in them are the disinfectants, are the antiseptics, hand sanitizers. So if you're a vendor, work with, and you're selling these things to your customers, or you're a school and you're buying them, you want to pay attention to dates. And I put this stuff in my inspections so that I'm going around and I'm making sure that I'm replacing these annually or however often, excuse me, that they expire. But again, some of this may go out as hazardous waste. So hand sanitizers is a much more confusing situation. And by the way, they're not under disinfectants. They're regulated by the Federal Drug Administration as an over-the-counter drug. And so manufacturers are required to list an expiration date unless they can show that the product's stable for more than 3 years. So it's a real issue when you look and you don't have an expiration date, because another thing that's going on, see, these are these temporary policies, is the FDA felt like, well, people are going through this hand sanitizer so fast, you don't need to put a date. So it makes it hard for those at our end, the users, to figure out how viable is this product and at what point does it need to be disposed of. So here is a situation where we had more than a case of hand sanitizer that expired, is flammable, and is going out as hazardous waste. Okay, hear ye, there's a new thing on the block, which is until now, we always talked about disinfectants were only good for non-porous surfaces. So now EPA, through the pandemic, under a lot of pressure, started looking at products for non-porous surfaces. So there are now products on List N, which is EPA's list for emerging pathogens for SARS-CoV-2. And they have, fabric cushions, and there are a couple, just a few products on List N designed for use on porous surfaces. And they were mostly laundry pre-soak, and there was a vaporized hydrogen peroxide, which is more of something, a fogging system. So there are there if people are concerned, but again, remember, we are going back to pre-pandemic cleaning and disinfecting. But I can no longer say in my trainings and disinfectants are only for non-porous surfaces. Here's another new thing. Here ye is, until now, you could not make a claim that a disinfectant had residual effect, which means that there's some ongoing microbial action, antimicrobial action after you've applied it. And so that is now being reevaluated. Products are being submitted under this review. And so one of the confusing things about this is if a product was both a disinfectant and a sanitizer, people were saying, well, it does have residual effects. But what's important to know is that those residual effects are just for the antibacterial. It's not for viral. But now EPA recently implemented this review process for evaluating two products. One is disinfectants that could possibly have a residual activity, and what they call a supplemental residual antimicrobial product, like a coating or a paint. And there's somebody I saw who's on the webinar who might be able to speak to this, that may have products like this. And so they're not intended to be used as a disinfectant, but as a supplement. And so there, I provided a link to the EPA. There's an appendix to List N that has these products. And I went on it, and there was only one product that had copper in it. So if somebody is making a claim that their product has a residual effect for a virus, or for a disinfectant or some kind of surface coating, you need to check this supplemental residual list, because I'm sure, like all the other List N items, they continually being added to because there are products now under review. And these are important because what was happening, I was getting calls from schools saying, oh, they want to sell me something I can put on the desk and I won't have to clean and disinfect because it will, or I won't have to disinfect because it will continually kill the virus. And then people were talking about putting finishes on floors that were antiviral. So part of this presentation is we really had to sort through all these claims that were coming at people.
Hey, Lynn.
Here's, excuse me?
Lynn, can I?
Yeah, sure.
I actually am the person you probably referenced on the thing, and I do work with antimicrobial coatings, and I've actually worked with a lot of people in the EPA over in last year about this process. Can I get your contact information to talk to you about this after the fact? Because there has been a lot of changes in direction from the EPA. Actually, our specific product is registered as a antiviral, anti-disinfectant in 20 countries around the world. The USA's process has just been kind of a cluster mess. But if we could talk after the fact, I'd like to bring you kind of up to speed on things.
Michael, thank you so much. And what I'd like is if you could go ahead and just put that question in the chat. We'll make sure that Lynn gets back to you. And I'd like to encourage everybody, if you would hold off on comments verbally until the end, that would be best so that we can get through a ton of information. But thank you for doing that. Go ahead, Lynn.
I called him out, so it's my fault, but yeah, so yeah, no, that's great. I just want to say in response to that, and it may be that EPA is not up to speed and their process takes so long for review, and they were doing all these expedited reviews, which they're no longer expediting review now that the CDC has a new guidance. But we, in terms of us in the field, could never recommend anything that EPA hadn't approved for that reason. So that may be so, just our position is that we could not. So I want to just talk for a minute, what is there to know about hand sanitizers? And I don't know if you know this, but they're considered to be over-the-counter drugs, and parents must approve their use in schools. And that there is no product that the FDA is approved to prevent or treat COVID, even hand sanitizers. And this is a really important link that I've provided to you because FDA maintains this list of hand sanitizers that have been found to have some really toxic ingredients. And the thing to know about it is, even if the manufacturer has not done a recall, there might be products included on this list because of FDA concerns. So I recommend both distributors and end purchasers take a look at this list. And because it's continually being updated, I saw some more today. The other thing that was really fascinating to me is that FDA only approves certain active ingredients to be used in hand sanitizers, which is the alcohol, could be ethanol or isopropanol or isopropyl. The quats are allowed, they do approve, but we don't recommend for all the reasons that Carol said. But I do want to say that what they're saying is any other active ingredient, because sometimes they'll have supplement, they'll have alcohol, they'll have, aloe and other things. But if the active ingredient is anything other than an alcohol or a quat, it's not a legally marketed product. Okay, moving on from specific product types and issues, emerging issues around them. I want to talk a little bit about how we can help schools consolidate products. I implemented a green cleaning program in one of my food services. We had over 62 buildings. We went from 27 products, I did that backwards, 27 products down to like 7. And so it is really a great way for us at our end to be able to manage products more safely and to have a much better handle on them. So as many products as you can consolidate is best. And I want to give you an example of disinfectants in particular, because we now have a disinfectant that we are super excited about because it deals with bloodborne, it dealt with SARS-CoV-2, it deals with food contact. And, so I can talk about that if people want to know what it is. But what was exciting about it was I could take and just consolidate down to one disinfectant / sanitizer, because it did both and it was no rinse. And what was really important about that is, as I was disposing of cases and cases of expired products, it's like now we can get down to just using one. Okay, and I have to tell you, as a trainer, it makes things a lot simpler. Safety data sheets, the fewer products, the better. And so what do we need to think about when talking about products and how you use them? And this is particularly important, is about rinsing. We all know that we need to clean, need to promote the cleaning before rinsing, before disinfecting. But if you do that, my concern is I'm always on the phone with the distributor or with my distributor saying, do I need to rinse in between using my product? So if you're using an oxidizer like hydrogen peroxide to clean, do I have to rinse before I use a corrosive disinfectant? Because you don't want a chemical reaction. And so you want to make sure that users check the label. You want to actually provide that information, point it out if rinsing is needed. So again, we talked about quats. You don't want skin contact, food contact surfaces. Some products require it and some don't. I want to clarify one thing that Carol said earlier, is that some sanitizers, when you use them as disinfectant, if they're registered to be both, they can either be required to have a longer contact time and or a higher concentration. And I want you to pay attention to the fact that some sanitizers at the diluted form don't require a rinse, but once you use them in concentrate, they do. And I think tabs, the hypochlorous tabs was one of those. And so I would direct people to read the product label. And the important thing to understand here is that disinfectants are regulated very differently than regular products. So they're regulated by EPA under the pesticide program, and they're not regulated under the hazard communication program for labeling. And so the label is considered the law. Following the directions is considered following the law. And if you don't, then you're not in compliance with the law. And on a day-to-day basis, that might not get anybody into trouble. But if somebody had a problem, this is really considered more than just information. It is really It's based on manufacturers' testing, for efficacy. And so if you don't follow this label, you cannot guarantee to the people in your building that you've really disinfected properly. So here's where I wanted to get a little deeper into the difference between these two regulations, because most people are used to dealing with, cleaning products under OSHA hazard communication. And here's where there's some confusion here that's really important. And I'll explain how I found this out the hard way. So FIFRA is the Federal Insecticide, Fungicide, and Rodenticide Act, and it supersedes the label requirements under the HAZCOM. And so you can, under FIFRA, provide a safety data sheet, but there are requirements about the information that must go into it. Okay, so there is not supposed to be conflicting information in the safety data sheet, but that doesn't mean there isn't. So EPA requires disinfectant manufacturers to put a section at the end of the SDS about the pesticides, right? And so it's not supposed to contradict, but watch this. So, okay, so the discrepancies are, so you might have a concentrate, and I'm going to use the tabs, the hypochlorous tabs as a perfect example, because that was my experience. So on the jar of tabs is the pesticide label for the primary product in concentrate. But the manufacturer had also put the same information for our labels to go on the spray bottles. And what happened was, people were really scared. They did not believe us that it wasn't a danger, right? So EPA does not allow you to have a reduced amount of the active ingredient. So if the active ingredient is something hazardous, you're not allowed to put a reduced amount. And you cannot have reduced precautionary statements. So here's the section in one SDS, and sometimes it's under 15 and sometimes 16. And it tells you these requirements differ from the classification criteria and hazard information required for SDSs. So this one says danger. Let me show you something. All right, per tabs. This is the hypochlorous tabs. This is on the same SDS. So one section says warning, and it gives you a pH of 5.5 to 6.5, which is not corrosive. But the section in the part that talks about it being a pesticide at the very end, section 16, talks about it as danger, and it's a corrosive. And it causes irreversible eye damage, which could blind you, or burns. So it's confusing. And so I can tell you over and over that when we put products into the user's hands at the ground level and they read these labels or they read the safety data sheets, we get a lot of pushback. So it's really important I really recommend if you're a distributor and you can get your manufacturer to generate the information on the label, like there is some flexibility. We have a fact sheet about where you do have some room to provide more information if you have the test data for it, but you really want to work to get information on those labels or develop a handout for end users to really understand the level of hazard in this product, because the information out there, the SDS and label, is very confusing. Yeah, so you take a look at what your labels say, because we were given stuff by a vendor and I didn't know about it at the time. This happened many years ago. But we ended up with departments that would not use this product. Okay, here's a really good example of that some products are not a one-for-one switch, and why that's important is during the pandemic when the supply chain issues, like these tabs are made in Ireland and we couldn't get them and they were back ordered. So we started looking at what was available here in the States. And this is the same exact product, okay? It has 3 different EPA registrations numbers. It comes in 3 different concentrations. It takes a different amount of tablets to make a gallon. And it has different parts per million for the concentrate and different contact times. And that's all based on whatever work the manufacturer did to get this registered with EPA. So what I would say, if you're selling things like tabs that are being manufactured by a number of different companies. You want to make sure that your folks really understand what they need to buy. Because I'll just give you an example. My guys are like, oh yeah, I just use 2 tabs. We use 2 tabs of the other one, and I need to do 2 tabs. And I can tell you, when I write guidance, I had to say, if you use this product, use this many tabs. If you use this product. So it's huge, because it's an efficacy, it's a toxicity issue, it's a waste issue. Here's an example of information from the manufacturer, and I am going to tell you why this is such a nightmare for the end user. So this particular chart is needs more complete information, because they give you information for the different uses. But the ppm, they give you a different part per million for different contact times. And I'll give you an example, say with the tabs. If you want like a minute contact time, I'm trying to remember, I'll just ballpark it. It might have been a minute, you needed to use 4 more tabs. And if you wanted, if the 10-minute contact time, you use less tabs, right? So my guys were like, oh, well, I want the shorter contact time. But what's important to relay in that case is it's a higher concentration, so it's more hazardous. 2, it costs 4 times as much to get the shorter contact time. So you really have to look at that. Then the other thing is that although this chart does not state it, I know for a fact that this product requires a rinse on food contact surfaces when it's used as a disinfectant sanitizer. And not all of the end uses have the contact times. So if you're a manufacturer, you're a distributor, you really want to get the end user much better information than this. This is very incomplete. Okay, so I'm going to move on from products and talk about application equipment. I just want to check in with my time. How am I doing, Pam?
You're great, Lynn. Go ahead.
Okay, so all right, this is one of the most controversial things that we dealt with this year. And before I get into the details, I just want to say what happened was these products have been coming on the market slowly, and then until now. And then this year, obviously, there was tons of, Mr. Foggers, Misters and Foggers, Electrostatic. And part of the big issue that I'm going to do a deep dive into in a minute is that we didn't know what products were approved to be used in them. And that's because at the beginning of this, List N did not say, products had not been tested to be used in this type of equipment. And because the label is the law, it has to say on the label whether or not you can use the product in any of these applicators. So I get calls all through the year about, and one of my guys is on the call, I won't say his name, but calling me, have they approved it yet to be used in electrostatic? Because I have districts all over the state, and actually nationally, I work with some national groups that have bought thousands of dollars of equipment that they don't know what products they can use in, right? So I just wanted to give you some of the guidance that's out there. So this is just Green Seal's chart about whether or not you should use the different kinds of technologies to apply disinfectant products. So under fogging, and I have a whole fact sheet that will be going into the handbook on fogging and misting, and Green Seal does not recommend it, and I'll talk more also about who doesn't recommend it. And then electrostatic, EPA was reviewing safety and effectiveness, and some of the issues there are like the products need to have been tested. So we'll talk about that a little more detail. So again, I said you need to look on the label, and I found tons and tons of inaccurate, misleading information on the internet. And some of the things that are most misleading is when you have a company that's saying, yes, we tested this product in our equipment, and we did, we used NIOSH and OSHA third-party testing, and it didn't exceed any permissible exposure limits. Well, my concern with that, I think I show it here. Okay, hang on one second. No, all right, I'll show it in a minute. Sorry. The problem was it was not on EPA's List N, and I'm going to show you in a minute where that should be. And so even though they have these studies, unless it's on List N, I couldn't recommend it to you. So how products need to be approved, right? And so why does it need to be approved? So what we understand is that the product's efficacy can change based on, an electrostatic charge maybe being put to it. We don't know what byproducts are being created. We don't know how it changes, how it gets in the air and the level of respiratory exposure. So if it wasn't tested, we can't guarantee its efficacy. And if you're dealing with an infectious disease like we were, and earlier we thought it was contact transmission, then that if somebody gets sick, there's liability there. And so if the applicator is not listed on the disinfectant label, that means it has not been tested for respiratory issues. And that's an issue because I can tell you all this year, I could not tell my schools what kind of respiratory protection they should be using because the product hadn't been tested to find out. So as an end user, it's a really, the information is not out there. So I'm gonna do one thing. Just give me 1 second here. I just need to move. Okay. So how do you know, how can you work with your buyers to know whether or not a product's been approved? And you as facility managers and users, how do you know? So, all right, so EPA had an expedited review about looking at these products because everybody was using them and everybody was using this equipment. And so they expedited this review, but as of the end of April, there's no more expedited review. So any products that were in that review process, it's gone back to its normal schedule. It's not expedited anymore, but they were looking at it, right, because they wanted to see, who got approved. People were submitting them for approval. So let's see. Okay, I'm going to show you. So EPA List N, again, is that list that they have on their website. It's searchable for finding products that are approved for SARS-CoV-2. So this is what it looks like on the website. So this is my favorite. This is the advanced search page. I know I'm kind of a nerd, but so you go onto the formulation type to look to find out what equipment it could be used in. So then here's what this is the list of formulation types that they have, right? Dilutable, ready to use, but electrostatic is what you're looking for. There's also mist and fog. I don't have slides on this, but I just want to take a minute to say EPA uses these terms interchangeably. They don't give you a definition. So it was really hard to figure out exactly what equipment fell into this, but there was only 3 products approved under mist and fog, and 2 of them were the same. There was 3 products and they were, 2 of them were on both lists, and none of them are approved are for the type of products that you would use in a school for surfaces. Okay, so if you do the search, this is what the search looks like when you print it out, right? So here's a product that it says it right there, electrostatic spray. Now let me show you an example of one, a manufacturer's web page. And so then I followed it up. This is what they said. Okay, here's some tips. And use a disinfectant that indicates spraying is a suitable method of application. Well, that's not true. It has to say electrostatic. So that's misleading. So I went on, I did my search, and it said dilutable. The other thing to pay attention to is there are a lot of, these are the type of companies that are getting into this, people that normally would do pest control. So we're seeing pesticide applicators. We're seeing all kinds of, paint sprayers. We're seeing all kinds of equipment in addition to the electrostatic and the Mr. Foggers. But so this is how I would track down whether or not something's legitimately approved to be used in these equipment. So if anybody needs help, there is a fact sheet that I put together on how to use List N. There's actually great videos on their website, and they also have an infographic. So if a product has not been approved, then you don't have the respiratory information. But one of the things that just came out, which I thought was helpful, but there's also some contradictions, is EPA came out with some language that said, if your product was approved to be used with electrostatic sprayer, this is the kind of respiratory protection you would need. So something with a low vapor pressure, right? So low vapor pressure would be, so yeah, low vapor pressure was like, you know, the citric acid. The higher vapor pressures were like hydrogen peroxide. And so that required a half face respirator, which is a real respirator, which requires a respiratory program, which is what most schools don't have. The reason that this is kind of fascinating is hydrogen peroxide based disinfectants are on the list of some of the safer products we have. But once you put it into electrostatic sprayer, that changes. And it's because it has a high vapor pressure. And so you could say, so what does vapor pressure have to do with it? So the higher the vapor pressure, the faster it gets into the air and into your breathing zone. Okay, so I have a link to this information if you're interested. So I wanted to share with you, could you look on the SDS? Because if you're like me, I'm looking everywhere for this information, right? Because I need to tell, I'm a consultant, I need to tell people what respiratory protection they need with a product. So I started looking, now that these products are coming on, being approved to be used in electrostatic, I looked at the safety data sheet. So here's one with the Oxyvir, one of the safer disinfectants, does require, this is their new SDS, does require a respirator, and it says it on here. But now you take the Clorox Pro Anywhere, which just came out, is great. It also, that has hypochlorous acid. The reference, even though it's approved to be used in electrostatic, the reference on the safety data sheet just references a mechanical powered sprayer. So it's really hard to track this down. And I am saying you go back to List N. List N is the most definitive source I know. The one thing that's interesting about this too is this does not require a respirator. This is the only product we've seen on the market come out for electrostatic that does not require a respirator. Okay, moving on. So that's one safety issue that I just covered, which is respiratory protection. I covered efficacy, if it changes being used in with a product not approved. So here's something that for all the years that I was using, that I started using many, many years ago, probably 5 years ago, I started using electrostatic sprayers, and we did testing. But what we didn't know, and no manufacturer or distributor ever told me, was you should never use this around a medical device, such as a pacemaker or a defibrillator. And you could, and you shouldn't be even 10 feet within it, within distance of it. If you have any questions, you want to contact, a doctor, but you can turn off the electrostatic function, but it's not going to, you're not going to get the same kind of coverage in the same way. So that's just something, that you plan for. But what I'm trying to say about this is you got to read the manual. I mean, this was buried in a manual. This was not in anybody's training. And so in reading the manual, we pulled this information up, and now I work really hard to get this out everywhere I can. And I also do say this does not replace reading the manual. I'm just highlighting it. And so I want to share a couple more things. This is where there was a problem with all this equipment that was coming online. Some of it may or may not have been appropriate to use in equipment. You can't use a flammable product in electrostatic because it puts a charge, right? So it can cause a fire. You don't want to use it around combustible dust. So these are really important things to know. The other thing is we've got to be grounded when we use these products. You cannot touch the nozzle because you can get a shock if it's on. So here's more things about grounding when you use this equipment. This equipment comes different, but the one has the grounding strip, one has what they call a grounding strap. It's really interesting because we had one company that talked about, they gave us both protective gloves, they were heavy duty rubber gloves, and they had the grounding strap, the grounding strip. But if you have gloves, you're not going to be in touch with the grounding strip. So this is really important for users to know. This is safety guidance. The other piece of this is, we're talking about respiratory exposures, is we don't want this product in the air. So aside from training custodians to hit the surface, we also really recommend that they turn the nozzle to the highest setting, so you're getting the biggest droplets, so the droplets are falling out of the air and not evaporating. But here's something to know is that as part of EPA's guidance on the labels that are coming out for products with approved for use in electrostatic, is you cannot, you need to limit the size to greater than 40 microns. So there is guidance about this. Okay, moving on. So that was safety information. Now I want to talk about agency positions on Mr. Foggers. So we're now getting regulatory pushback. Well, actually, there's been regulatory pushback since 2013 from EPA. I think I have something to show you on that. This advisory is from the state of New Jersey Department of Environmental Protection, and that is saying that if the product is not approved, you shouldn't be using it. And Vermont, the state of Vermont, is recommending against it, and the CDC. And so the two issues, and this is from 2013, and I have been monitoring, and they have stayed with this position that the health risks, they're really concerned about the inhalation hazards because the fine mist can stay in the air till it dries, depending on the setting. And then the efficacy they were concerned about is if it doesn't apply enough product to the surface, then it may not provide enough coverage to kill any microbe. So this is just really briefly, there's lots of different, I have a whole fact sheet on this. This drove me crazy. There's no one definition of misting and fogging. And actually one of the vendors who's on here today, we spent hours trying to figure this out. I spent a lot more time than that since then. But in general, misting is microns about 200 microns in size, droplets 200 microns in size. And the reason that's important is it drops out of the air versus a fog, which is small as 10 microns, which it can remain suspended. Okay, so I'm coming into the home stretch here. Just a couple things about electronics. We recommend that people go to the manufacturer's website because they do have information about what is safe and not safe to use in a particular product. But the real key thing here is that if you're using a fogger, there was a study last May that said that powered, equipment that's powered on, like, so if you're a custodian, you're going in and it's equipment that's on electronic, it can get drawn in by the fan where it can damage the electronics. So they recommend powering off and covering electronics before fogging. And then with any disinfectant, we're not applying to paper or any kind of porous surface. And then lastly, this is the issue with the most confusion, which is using disinfectant wipes at school. People use them for sanitizing, for cleaning. So we have this handy dandy little poster that I made to let people know what the difference is and what we're doing. And we're really training our schools on what products to use for what job. The other thing to know is students cannot use disinfectant wipes, cleaning wipes if approved by the school, but not disinfectant wipes. Okay, in summary, these are the things that I believe, these are key points. I have a whole set of key points to ask vendors and key points that vendors should work with their folks. So you want to talk about product availability and any related supply chain issues. And that is because you don't want to run into what we did. It's like we bought some of this and then we bought the same product with this name. And then I just bought it in this name. And so when I do training, I say, these are all the same product. They just have different names. So if at all possible, talk to the buyer about this product's more available. If you get this, I mean, this issue may go away now that COVID's lightening up, but it was an issue. You want people to understand, is this an approved product on EPA's list N? I give people the EPA registration number because I train people how to go on list N, because you can find out everything about a disinfectant by this EPA registration number. Contact times, what you can use it on, everything, concentrations. We want to let people know whether or not this is a safer ingredient. Is it on EPA's DFE list? I want to tell people what the uses are. What are the physical and health hazards? And I will give you a very specific example. I had a vendor that promoted a product to be used all day long by custodians that was a sensitizer. And so a sensitizer, you'll eventually become sensitized to the product, develop maybe allergic reactions, and then even become sensitized to other products with similar ingredients. And so maybe if it was a one-time use for something that was really hard to find a product for, but you would never use a sensitizer for a daily product that somebody's using all day long. And then you want to let them know what dilution rates and contact times are for specific microbes. It is not a one size fits all. For bloodborne pathogens, I might need a higher concentration and contact time versus doing the bathrooms. This is the last list. So you want to look at the shelf life of a product, what kind of personal protection and ventilation is needed. If you're in a school that doesn't have any mechanical ventilation, do not sell them toxic products if you can help it. What kind of applicator is it approved in? What are the storage requirements? And this is big right now because people are buying cases of flammables and cases of things like hydrogen peroxide, which oxidizes, and you cannot legally store them in the same room. And then lastly, if you need to know what the disposal requirements are. Is this going to be a hazardous waste when it's all said and done? So these are just to wrap it up. These are documents. So this is our document here over on the right that will be out soon, hopefully in the next month. This is the TURI website. This is Carol's on my website, Informed Green Solutions. You'll get links to all these. And this site is amazing. This is our real user site for the National Pesticide Information Center. So if you have questions about safety of antimicrobials, this is your go-to place. So that's it for me.
Oh, Lynn, thank you so much. And Carol and Julia, thank you so much. What rich information. I've been trying to share some of the links that you have on there. I've also shared a PDF of the presentations themselves. So Julia, Lynn, Carol, if you could turn on your videos, I'd love to invite our audience to ask questions. And what I'd like to do is to ask you to raise your hand. And the best way to do that so that I catch it is to, if you click on the participant icon on your Zoom screen, there is a raise hand option there. We did have a couple of questions in the chat, one of which was asking about alcohols and being encouraged to use alcohol as an alternative, but feeling that it's really not the best option. So any response on the use of alcohol as a disinfectant, and then I'll move to Chris. Thank you for using your hand there, Chris.
Well, first of all, should I take down the questions and answers so they can see more people? Or...
Sure, thank you.
Okay.
Yeah, stop
okay.
sharing.
Okay, I'm working on it. Okay, it just says new show. Oh, stop share. There we go.
There you go.
Okay, yeah, there we go. So, I mean, there's a couple things I would say, and I'd love to invite Carol and Julia. My concern about the alcohol-based is, I think there are some safer alcohol disinfectants, and Carol, I think, can speak to this. But I was concerned about having flammability. I think they had a flammability of 3. And so they didn't require personal protective equipment, and there was other good attributes, but I do not want a flammable with a flame rating NFP of 3 because we have hand sanitizer and we have wipes, and it's just too much flammable, and people don't have safe storage and they don't necessarily understand. And we're getting cases of this stuff. And do you want to have to get a fire department permit? Anyway, so that's one of my, and then the other issue is, if you're getting that and you have any kind of oxo, say you have hydrogen peroxide cleaner, all-purpose cleaner, then you cannot store them together because an oxidizer will feed a fire. And that's a class 3 flammable. So.
Yeah, really good point. Julia, anything to add there from OSD's perspective?
No, I don't. Sorry.
It's okay.
I think that's more of a technical question. I mean, the only thing that I know is that, you have to be concerned about flammability, especially in schools.
Right.
So.
Good point. Chris, your hand is raised. Thank you so much. Go ahead and ask away.
Sure. Thanks. I hope I got the buttons right this time.
You did.
Lynn, that was absolutely, Lynn and Carol, that was fabulous. All of you, fabulous and great information, Lynn. I mean, I learned a lot. Thank you. One question I have, and we've been grappling with is, you know, we have not been, we've been recommending the same safe active ingredients, I think, as Carol's group and most other, and Turi, with the possible exception of Thymol. Thymol, we kind of put that in the middle ground. But we're kind of reconsidering with the tabs. And I understand, and I think Turi had some evidence that with respect to the chlorine that's generated when you have the solution made from the tabs, it's lower than from, you know, a bleach solution, which means it would be less of an asthmagen hazard. I wonder if there's any other data out there on that. We're at the point where we're gathering this kind of data together to update our own recommendations. So
Yeah.
can you speak to that? Can someone speak to that?
Well, let me just start off, and thanks for raising that. And you make a really good point. So there is the DFE list of safer ingredients, and then there are some other ingredients that are generally thought to be safer. Thymol is one. We don't include Thymol because we worry about its sensitization properties. The hypochlorous acid that is generated when you use those tabs that Lynn was telling us about, it does have chlorine, right? It's a hypochlorous acid. And so we've done some exposure testing to get a sense of the amount of chlorine gas that might be generated during the use of that product. And the results of that study actually should be on our website. And if they're not already, it will be soon. So I apologize for not knowing that. It definitely shows that the amount of chlorine that a worker would be exposed to is significantly less than what it would be if you were using a bleach-based solution. Also, that the exposure tends to be in the generation of the product, not in the use of the product. So it's interesting, but it is significantly lower. And so we consider it to be a safer alternative to a bleach-based solution or a quat. Anything that anyone else wants to add to that?
Yeah, and I'll just add that, you know, we have allowed food grade NADCC tabs on the FAC 85 contract. We allowed this a couple of years back. It has to have a specific CAS number, must be able to maintain a pH from 4 to 6.5 and only be sold in tab form. So those were the specs for allowing that as an active ingredient on the FAC 85 contract.
Thank you.
So this is Lynn. So we did some exposure testing in buses with the bus closed, and we did the personal, and we worked with Turi to do this many years ago. And we did not exceed any permissible exposure limits, which we know, you know, OSHA, they're really old exposure limits. But the one of the things that Jason says, and you could help me out with this, Pam, is that one of the reasons that the hypochlorous acid is not on EPA's list of approved products for disinfectants is that there's some byproduct in wastewater treatment, but it wasn't related to its use in the form that, you know, for disinfecting. Are you familiar with that, Pam? Am I remembering that correctly?
Yep, sorry, I was talking and I was on mute. So you are remembering that correctly. So hypochlorous acid has been used in wastewater treatment applications. And what they've discovered that in a wastewater treatment application or a water treatment application, there are organic materials present that combine with the chlorine to create trihalomethanes, which are a real concern, environmental concern. And so because of that, EPA was not approving, or the DFE program was not approving the use of hypochlorous acid as a disinfectant. So the feeling is that in a disinfecting environment, particularly when you do the first critical step, which is to clean first, always, the amount that you really won't have that organic material present, and you won't be creating these trihalomethanes that are the kind of the source of the concern. That's my understanding as well. We have a question here. What is your...
Before we move on, just one more thing. So that EPA, I mean, that Clorox Anywhere product is hypochlorous acid, but it's not from TAB. It was approved and it doesn't require a respirator. So it's new, that's all I can tell you about it at this point.
Thanks. Okay, so we have a question here. What's your opinion of EPA treated article exemption? I'm not sure I know what that is. So Michael, if you want to unmute yourself and expand on that question, you're welcome to.
Sure. So when the lab went to get approvals for our antimicrobial in the United States, as we all know, it's a long and lengthy, expensive process. And again, I want to backtrack and say we are approved as disinfectant in over 20 countries in the world. They registered as a treated article exemption under FIFA in the United States. Our product is legal to sell and use in all 50 states. It's legal stuff. So Lynn, I was kind of wanting to see what you thought about that kind of, it's basically a background in a way. We were, as I mentioned before, literally expecting approval from EPA. We filed an 18 waiver in Rhode Island, worked with the Department of Health, DEM there, and at the last freaking minute, this EPA called us up and said, yes, we're not doing state-based waivers. And that was the guidance they directed us in from the beginning. So now we are working on our Section 3, just like everybody else. We were expecting to be the first Section 18 waiver for widespread use versus other priors being very specific, narrow focused. So it was kind of a kick in the rear end that we didn't expect. But our product, I have all kinds of data and studies to show, and I would love to have maybe an offline conversation with you, because it's maybe not the right format. But I'd like to get your opinion on how you would recommend us as we have a treated article exemption. Our product can be used. I can't put health claims on a label. I certainly can't say that, but I have tons of documentation to support other things.
So yeah, I'd like to respond to that. So Carol and I talk about this a lot. Like, people claim that alcohol can work and this and that. But for those of us out there providing guidance, it's you either feed somebody for a day or you feed them for a lifetime, right? You teach them how to fish. So we always recommend that you consult certain guidance, right? Whether it's third-party certified or EPA approvals. So I would not, in my understanding, and Carol can speak for herself, ever refer somebody to that didn't have some level of regulatory approval or certification, just because, something else is going to come along and somebody's going to make claims. And like I said, there's
Right.
claims. I've actually called manufacturers and made them take stuff down off their website because I could prove that it wasn't accurate.
And how do you feel about international data? Like I said, we're listed as disinfectants, persistent disinfectants in well over 20 countries around the world. We've got EU certification. We're the #1 player in Singapore and China, things like that. Again, I don't want to get all crazy. It is a UPS regulatory nightmare that's been a hiccup. We all know this.
Yeah, I mean, I don't know, Julia and Carol, if you want to weigh in. I just think that, my folks, I mean, I can tell you at the school building level or school district level, they're not going to look up European data. We need to give them some guidance that they can go by. And it is an emerging field and things are changing by the day. So again, so that's my position, but I'd love for anybody else to.
Yeah, because I'm kind of stuck in a rock and a hard place on this.
Any other thoughts, Julia or Carol?
Yeah, I mean, for our contracts, we want to make it as easy as possible for buyers to find the products that meet our specifications. So that's why we have specific requirements on, using third-party certified products. And then with the disinfectants, it's really and sanitizers, it's the approved active ingredients and the prohibited ones. So that's our line, at that point. And we just need to make sure that everybody has the right paperwork, and meets those requirements. And it makes it easier for the buyer and for us just to make sure that we're managing the contracts.
Right. And Julia, we were going to work with Mass Department on our 18 waiver for Mass. We were ready to submit that application right when the CDC kind of cut us off too. We'd already had conversations with several people in that process.
Mhm.
So,
Yeah.
I mean,
So,
our
I
ingredients
mean-
are past muster. It's just process regulate, stuff.
Thanks. So, I mean, we encourage you to keep working on that. And there's some basic guidance here, which is we like to really stick with what has gone through the whole approval process. And so I want to just invite, does anybody else have any questions? For any of our speakers. Lynn, go ahead.
Just if there's things that are challenges, like we have this handbook that we've been working on, and we did it 10 years ago, and we're just finishing updating it. But if there's other questions that you have that we didn't speak to, we have so much information, there's no way we could cover it here. And I do, for those of you at the school building, school district level, I have like sheets of questions to ask your vendor. So this was kind of from the perspective, vendor provides this to the buyer, but I also have it the other way, so.
Mhm. Yeah, good point. Yeah, these guys are a wealth of information. And as Lynn and Carol mentioned, the infection control guidance has been updated, and we're just going through some final, some final approval to get it uploaded. So keep an eye on Tori's website for that. We have a question here. How is the supply chain now for these products?
So I can answer just from OSD's perspective. It's much better. And we're really not seeing the issues that we saw months ago, where really folks could not access anything. So from our perspective, it's not an issue. So I look forward once again to the state of emergency being relaxed and really going back to the greener, our approved products for disinfectants and sanitizers.
And I think, we've learned so much as well, so that should there be a backslide, I think we've learned that disinfecting surfaces is not the primary way to protect people. It's really the masking and the social distancing. And if you are feeling like you need to do, more disinfecting, start with cleaning. Use safer products, and you will be very protective. I mean, that is sufficient. You don't need to move to bleach or quaternary ammonia compounds that put your users at risk. So that, I think, is an overall message for all of us. Any, really great job. I want to thank Julia and Carol and Lynn so much. Any final comments from any of you for our audience here? Nope.
No, I just want to thank everybody, this is recorded. Please share with folks. We had a lot of folks who had signed up, and for us at OSD, we're going to be really asking our vendors to review this, who are, in positions where they are using cleaning products, are providing some type of service, so that they can understand, what's been presented in this webinar. So thank you so much.
Thanks. And listen, there's one last question here that I think we can sneak in the final minute. And that is, if an electrostatic sprayer sends the disinfectant to a negatively charged surface, how is that a problem in the air?
Oh, yeah, that's a good, am I?
Go ahead, you're good.
Yeah, right. So, yeah, right, because it's going to draw out, right. So it's going to draw out the price. So for people the electromagnetic electrostatic applies a charge, a positive charge. It's attracted to a negative or neutral surface. So it will wrap around the surface. It will coat it more evenly instead of the drops going together. So there's some issues like there's been some talk about what if there was electrostatic energy from like the carpet? Are there things that would compromise that? There were questions about what happens to the product when it gets put through the electrostatic charge. Does that change its chemical composition? Would it combine with anything in the air, creating other compounds? So there are some other questions. I mean, when I was writing my fact sheet, my first thought and my experience was, well, it wraps and it's drawn to the surface, so it's less of a respiratory hazard. But unless it's tested, a product is tested for that technology, you cannot say that. You really can't say that. And then you have to look at, are there other things in the room that change that field, the electrostatic